I am Dr. Vaibhav Somani, consultant gastroenterologist and hepatologist at Bombay Hospital, Marine Lines, Mumbai. Today I will be speaking on NAFLD, that is non-alcoholic fatty liver disease. It is a condition which is very common and rampantly prevalent all over the world. It is a non-communicable pandemic in a sense. What is non-alcoholic fatty liver disease? As we all know, fatty liver disease is very common, and most of us have seen whenever we undergo a sonography of the abdomen, we see fatty liver written on most of the reports. So it is basically fat deposition in the liver. Normally, fat deposition in the liver cells is around 5%. If it is more than 5%, it is considered as fatty liver disease. There are different causes of fat deposition in the liver. Alcohol consumption more than a certain limit is one of them, and there are many other diseases which causes and drugs which causes deposition of fat in the liver. Whenever there are no other causes and there is fat deposition in the liver, it is called as non-alcoholic fatty liver disease. What are the risk factors for non-alcoholic fatty liver disease? It is usually a part of something called as metabolic syndrome. So metabolic syndrome includes obesity, specifically central obesity, hypertension, hypertriglyceridemia or high LDL cholesterol, low HDL cholesterol, which is good cholesterol, which is low, and LDL is bad cholesterol, which is high, and diabetes along with it. These all parameters together are called as metabolic syndrome. So non-alcoholic fatty liver disease is part of a metabolic syndrome, and it may not be part of metabolic syndrome and can be detected alone also. It is rampantly prevalent all over the world. In America, it is 25% of the population is affected with fatty liver disease, and in India around 32% of the population is affected. So you can make out how common it is. So basic idea of this talk is to make you aware of this disease and how to prevent it and how to treat it, and to let you know what are the symptoms. So usually the symptoms, first and foremost is it is detected only incidentally for when you go for sonography for some other reason. Second common symptom is fatigue and right upper abdominal discomfort or pain. These are the common symptoms. But whenever fatty liver disease progresses to more severe form in the form of cirrhosis, then the other symptoms of cirrhosis like jaundice, easy bruisability, swelling over the limbs, abdominal distension, these all are common symptoms of cirrhosis. They come when patient develops cirrhosis. So it is an ongoing disease where it starts with non-alcoholic fatty liver, where there is no swelling on the liver. Then it progresses to non-alcoholic steatohepatitis. Hepatitis means swelling over the liver. So once fatty liver progresses to swelling, that is rise in SGOT-PT in your liver function test, it suggests rise in the swelling in the liver. So non-alcoholic steatohepatitis is the second stage. Then it follows, if it persistently stays there for 10-20 years, then it leads to fibrosis, stage 1, 2, 3, 4 fibrosis, which means increasing stiffness of the liver, and which eventually stage 4 fibrosis leads to cirrhosis. So cirrhosis is the irreversible damage to the liver. So there are many causes of cirrhosis, which includes hepatitis B, C, alcohol, and fatty liver disease. Currently, fatty liver disease is one of the most common cause of cirrhosis in Western world. So you can imagine how important it is to prevent it at the early stage so that we don't develop cirrhosis. And liver cancers are also common in these patients. So symptoms, as I said, usually it is asymptomatic, and then depending on the stage of the disease, symptoms increase. You have what investigations you have to do to diagnose fatty liver disease is, first and foremost, it is sonography, which suggests grade 1, 2, 3 fatty liver, and it is quite observer dependent. Then other routine tests we do to, like liver function test is the most common amongst them. You have to rule out diabetes, hypertension, cholesterol, in these patients, and you have to rule out other diseases like hepatitis B, C, and other common liver diseases like autoimmune disease to confirm the diagnosis of fatty liver disease. Once this is confirmed, then there are some fibroelastic tests like fibroscan, which detect the exact stage of fibrosis, and if needed, liver biopsy is done in these patients. So once the diagnosis is confirmed, when we come to the treatment part, the most important is dietary changes, modification of lifestyle and exercise, which forms the core of the treatment. Then comes the control of sugars, cholesterol, hypertension, and last is the medicines for fatty liver disease, which are there but not very good medicines. But there are newer medicines like saroglitazar, obeticholic acids, which are coming into the picture, and they are helpful. So this is the treatment part. And how can we prevent it, which is most important? So prevention is the regular exercise, diet, avoidance of certain amount of alcohol, smoking, and maintain a good healthy lifestyle. Thank you.